Ezra, and a pleasant good afternoon to everyone. This afternoon, as per usual, I'll share with you the HEOC situation report. Okay, so over this past week, we've only identified 5 newly diagnosed cases of COVID-19 as compared to the previous week when we identified 7. At present, we do not have any hospital admissions. The recoveries for this week, 11, and no additional COVID-19 related deaths. So to date, the Federation have confirmed and reported a total of 2,791 confirmed cases of COVID-19. We continue to enjoy an excellent recovery rate with 2,753 recoveries to date, and at present we are only monitoring 10 active cases, 3 in Nevis and 7 on the island of St. Kitts. To date, we've only reported 28 COVID-19 related deaths. The related deaths, 86% of those who died were unvaccinated, and 68% were 60 years and over. And so again, today, I want to reach out to the older adults amongst us, those who are diagnosed with the chronic non-communicable diseases, diabetes, hypertension, heart disease, kidney disease. If you are not already vaccinated, we want you to empower yourselves with the information about the vaccine and come on board and accept same, because there is a risk of there's a risk of Omicron being introduced into our society, and based on the evidence, it seems to be more transmissible. So we want you to utilize this window of opportunity and come on board and accept the vaccine. In terms of the 2,791 confirmed cases, 70% were not vaccinated or unvaccinated, and 6.9 or 7% partially vaccinated. So again, if you are unvaccinated, you are vulnerable. So we want you to come on board and protect yourselves. The vaccination program continues, and it has been successful. It has been a successful journey so far. In terms of the vaccination coverage of adults in our population, 80.6% covered with the first dose, 74.2% fully vaccinated. And in terms of our children aged 12 to 17 years, 14.8% covered with the first dose and 12.4% fully vaccinated. So again, we want to reach out to parents, guardians of our children. We want you to help us to ensure that the school space is safe by consenting or providing consent for your child or ward to be vaccinated. This provides a disaggregation of the data between islands. So again, you would see in St. Kitts, 85.2% of the adults have received the first dose, and 77.6% have received the second dose or fully vaccinated. And you would see the figures for Nevis. But overall, in terms of the entire population, 53.2% of the total population fully vaccinated. We are going good, but we still have a long way to go in terms of reaching an adequate immunity threshold, given the fact that we have a new variant on the horizon and there's potential for more variants to circulate. The booster shot is available, and so we are reaching out to all those persons who are 18 years and over, those who have already received their primary vaccine series at least 6 months ago. You can come forward and receive the booster shot. We are given the Pfizer-BioNTech vaccine as the booster shot. Okay, so in terms of the Delta variant, it is still the most prevalent variant globally. And so we already know the features of this variant. there's a potential for this variant to be introduced into our population. And so that's why we want persons who are not yet vaccinated to come on board to protect yourself against the Delta variant, which is pretty severe and highly contagious. The Omicron variant came on the scene in the last week of November. It is easily the most mutated variant so far, with a number of changes in the spike protein. Now, we have results from an in-depth laboratory study on the Omicron variant, and what they have said is that this variant is extremely slippery. It eludes a great deal of protection provided by disease-fighting antibodies. That means individuals who would have had COVID before, they can easily be reinfected, and persons who have been vaccinated, they may suffer breakthrough infections. However, the positive news is that the vaccines, the COVID-19 vaccines, still provide a level of protection against severe disease and hospitalization. And the booster shot is also very effective against Omicron variant. The Pfizer-BioNTech group says that its booster provides and offers significant protection against this variant. So in other words, if you just have 2 doses, it may not be sufficient, it may not prevent reinfection. However, the booster shot provides significant coverage. The Omicron variant of the SARS-CoV-2 virus appears to be less severe compared to the Delta variant in terms of the severity of disease it causes, but it seems to be more transmissible. And so this is just this is based on anecdotal evidence and some preliminary data coming out of South Africa and those countries who that are impacted by this variant so far. So it seems to be more transmissible, but the disease cause seems to be less severe. Again, this is preliminary information. We won't be able to confirm this information for another month or so, because research is ongoing regarding this variant. In terms of its impact on countermeasures like the tests, based on the information so far, the RT-PCR tests continue to detect infection. However, they are still working on the other tests, the menu, the expanding menu, rapid antigen tests. They are conducting tests to find out if they can how effective they are in picking up infection by the Omicron variant. In terms of treatment, corticosteroids still remains effective. Again, studies are ongoing regarding the other treatment modalities. Just want to bring to your attention, there are some antivirals on the horizon. So Merck and Ridgeback Biotherapeutics, they have this new antiviral drug, molnupiravir, which reduces the risk of hospitalization and death by as much as 30% if the patient receives this drug within 5 days of onset of symptoms. There's another antiviral pill developed by Pfizer. It's called Paxlovid. It may perform even better than the molnupiravir in that it has shown that this drug is 85% effective when taken within 5 days of the onset of symptoms. And so this is positive news. 2 antiviral or 2 new COVID pills on the horizon. They are going through the approval process for emergency use authorization. In terms of the Omicron variant, the WHO recommends that territories like ourselves, we need to increase our public health, medical health system capacity. We need to continue the COVID-19 prevention and control measures, and we need to enhance surveillance, particularly border surveillance, and without saying, we need to improve all the world, COVAX and the international agencies need to improve equitable or ensure equitable access to COVID-19 vaccines across the globe. We are not safe until everyone is safe. And so again, I can't end without, reminding you of the COVID-19 protective measures. So if you are not yet on board in terms of accepting the vaccine, please empower yourselves with the necessary information. Look at your vulnerability and accept the vaccine. The wearing of the face mask, very important. Maintaining adequate hand hygiene, particularly at this time, Christmas time, when you have a lot of, tourists around, foreigners coming in from overseas. Protect yourselves by simply wearing your face mask and sanitizing, maintaining a safe distance. And if you are experiencing any of the COVID-19 like symptoms, please stay at home. Thank you.
Thank you very much, Dr. Laws.